The lab consists of so many different portions. There's so many different disciplines in the lab. Say 100% of the things are confirmed by the laboratory testing.
Doctors Hospital has reimagined primary care. We've invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations in Freeport and 8 Mile Rock, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
Hello, everyone, and welcome to the Doctors Hospital podcast, where we connect public health issues to what we do here within the Doctors Hospital healthcare system. My name is Eddie, the Learning and Development Specialist within the GLOW office, our hospital's wellness solution, and welcome to the Doctors Hospital podcast. Today, we have in studio the blood bank supervisor, Brensil Rolle, and we're about to talk about the services and all of the good things that happen in lab within our organization. So, Brensil, welcome.
Thank you so much, Eddie.
Is this your first time on the podcast?
I think this is the first one, but I can see myself coming on many and many more times if you will have me.
Please come. So we're talking about lab and we're talking about the services that we offer. And I know that during the pandemic, laboratory services would have increased significantly. But I think that is informed in the form of testing, and because there were so many COVID tests that we needed to have, because there were a lot of diagnoses that needed to be done. But I want us to kind of focus in on what lab and the services of lab really mean, and in the grand scheme of the hospital and what we do. So the first question is, how would you describe the laboratory's role in medicine today?
Well, that's a good question, Eddie. The laboratory's role in the hospital itself, dealing with inpatients, you can see the laboratory as a main cornerstone of hospital operations. All right, the laboratory and what we do is paramount to ensuring that patients come into the hospital, they're seen, and they are discharged in a healthy manner. All right, laboratory deals with just about every department in the hospital, whether it be from the ER, ICU, IMCU, even throughout discharge and somewhat pharmacy, if you really think about it. From the testings we do, we give the doctors the information they need to make a diagnosis and have a plan of more or less getting the patient well, healthy, back on their feet and out of the hospital. But like you said earlier, we do serve a paramount, we do serve a very strong source in the hospital itself, but we also supply outpatient services.
I wanted to touch on that. Yeah, go on.
A lot of people forget that during the pandemic, like you said, it was Doctors Hospital Laboratory that were at all the country's exit sites and leading the charge on getting people to where they need to be.
So they brought the best to test.
Hey, what are you? We brought innovation. We brought testings to your digital format, so you would be able to make your flight on time, even though whether it was in advance or last minute. Doctors Hospital were at those key entry and exit points.
Yeah.
Laboratory, giving you the test you need to enter in different countries and to come back home.
So lab is not really I would say a patient facing, but you do have interactions with every patient who's in the hospital at some point. I just heard the story yesterday about and I just want to say this to all our visitors as well. If you have persons in the hospital, please be easy on our lab people when you're visiting and they need to get results, because the results are very crucial and they're critical to the care and getting persons outside of the hospital. I know that y'all don't have the best job because y'all have to
on,
give.
We got the best job in the world, Eddie. Come on now.
Sticking people.
Hey, yeah, hey, we have some of the best people designated to stick you and make you feel comfortable
You
during that
do though, and that's
whole
what,
experience.
and that's the thing I wanted to highlight. I
Hmm.
think there's a particular personality that you have to have if you want to work in lab,
Hmm.
because otherwise you can't be grumpy and asking for a needle, which is gonna hurt me,
Yeah,
even though
I
it's
know.
good for me,
Hmm.
right?
It's like you said, all the things that laboratory does may not be patient facing,
Mhm.
but we do um, we do have a very strong patient facing force within our phlebotomy department.
Yes.
These are the people who make sure you're well and comfortable, especially in the outpatient services.
Mhm.
Every time the doctor comes and said, "Hey, we need you to go take some lab," that is our patient-facing force,
Yes.
and they are some of the best who come in
Yeah.
to really stick you and get you through some uncomfortable. I, I, I don't like getting stick.
Yeah, me
You
neither.
know, I have
I
people
would not
come
lie to
into the
you.
lab saying they scared of needles and they have tattoos, piercings, and they still scared of needles. So it's a truly uncomfortable feeling. But our employees and our um, staff and phlebotomists, they guide you through it. They'll hold your hand if necessary, and they make that uncomfortable session
Mhm.
as I would say as comfortable as it can be.
That's tolerable.
As tolerable. See, that's the good. Yeah, as tolerable as we can we can make it.
What percentage of lab work do the decisions? What percentage of decisions are made based on the lab work that we have to that you all do
Mhm.
within your area?
Now I'm kind of biased. You know, I work in the lab. I want to say 100% of the things are confirmed by the laboratory testing, but truthfully, we do extend a very, very strong. Um, we do have a very strong presence
Mhm.
in guiding the physicians and their plan on how to make you better,
Mhm.
but also in their plan on figuring out your diagnosis.
Okay.
I would say honestly, between 70 and 80% of all those doctors' decision making are done based off of laboratory testing.
Okay.
Take, for instance, I want to say, let's say you go to the hospital and you have a cut that looks like it's all
Festering,
infected,
yeah.
infected. What that doctor is gonna do, he's gonna swab that and send that sample to the lab.
Mhm.
What the laboratory is gonna do, we're gonna grow out any bacteria that is there. We're gonna do some additional testing, such called resistance testings.
Mhm.
That means we just test whatever grows against drugs,
Mhm.
and depending on how that substance grows, the doctor is able to give you prescriptions on antibiotics
Mhm.
um, to let you know what will work for your infection. And that's
Mhm.
just one
Aspect of it.
aspect of what laboratory services does.
Okay.
Because the laboratory is split up into so many different departments. People say lab,
Right. So
and
I wanted to make the distinction just for
Mhm,
us for our interested, because I'm sure that we have some younger persons who are watching the podcast
mhm,
who want to know about lab. And I'm saying blanketly
lab.
lab,
Mhm.
right? But lab consists of
The lab consists of so many different portions. There's so many different disciplines in the lab.
Mhm.
Me personally, I work in the blood bank. And that's basically large units of blood and dealing with blood transfusions. When it comes to blood donations, you see us all on the street
Oh
telling
yeah.
people to come in, please donate blood for those in need of transfusion. But that's
Yeah.
just one aspect of lab.
Right.
We also have microbiology, which is a department within itself. Like we just explained, the
Mhm.
doctor sent that swab down to the laboratory to test
What it
which
is.
bacteria is growing, which that is. In the micro department, they utilize susceptibility testing. All
Mhm.
right. And that what gives the doctor the information they need to prescribe you the proper medications to get better. We also have a hematology department. This department deals with your white blood cells and your red blood cells. Patients who come down with things such as leukemias
Mm.
and blood cancers. We have chemistry department, which deals with indicators, and
Mm.
that's basically your early indicators for cancers and other things. All of those samples go through the chemistry department. You also have pathology, which deals with large organs and systemic problems. So the laboratory in itself has subsets of disciplines that a lot of people specialize in and they go into, but it all comes under the umbrella of lab.
Okay. So you talked earlier about how decisions are definitely made based on the work that happens in lab. Um, are there any statistics or are there anything that people should be aware of regarding like lab? Is there like a heightened bit of something found as of late?
Well, as of late, I wouldn't say as of late. As our population has grown and become more educated,
Mm-hmm.
they have learned that they need to take their health within their own hands.
Right.
All right. And the first step in doing that is knowledge on what your body's baseline numbers are, what your body's chemistries are. Take, for instance, a diabetic patient. All right. We all live in the Bahamas. So we should know somebody who has diabetes.
Mm-hmm.
Every morning they have to take a prick of their finger
To test.
to test their sugar levels.
Okay.
That's also a laboratory test.
Mm.
All right. That sugar level gives the patient or the diabetic the information they need on what they need to, how they need to resolve their day, which medications they need, how they need to eat. So we take that on in the laboratory personally. We say, hey, you as a person, you should know what your labs are. Even though you may not know what each specific test means, you should have a um, baseline on to say, hey, my lab says everything is normal. You can walk around with this and you can have that for your own personal knowledge.
Mm-hmm. How does having an in-house lab improve turnaround time, quality, and patient care outcomes compared to outsourcing? Because we are in-house.
The majority of our testings are done in house.
Okay.
We also have
Hmm.
the ability to get referral testings performed at our laboratory itself.
So persons outside of our organization who are not being served as doctors, they can
Mm-hmm.
come with their lab instructions or prescription,
Mm-hmm.
and they can get the services rendered at doctor's hospital.
At doctor's hospital, we'll do that. Just bring in your doctor's requisition.
Hmm.
But we also are moving to a pace to where we want to empower the patients themselves to know and to demand which test they want. All
Mm,
right.
let's talk more about that. That's
But
interesting.
mhm, we have we don't really push this to the public because there are so many tests out there.
Right.
We always recommend that you see a physician first so they'll be able to narrow you down on which tests you may need.
Hmm.
But we don't want to discourage people in doing testings. We know with the advent of the internet and information out there,
Hmm.
they see so many different um, things online which can improve their health.
Right.
All right. We don't degrade the information from doctors, but we feel like patients should take their health into their own hands.
Mhm.
So if a patient walks in and says, hey, I want to do a potassium level on me just to see what my potassium levels are, you can come into doctor's hospital.
If this is so, you're saying if you just have a like an inkling
Mm-hmm.
of sorts, and you want to find out, like you said, your potassium level, how much
Mm-hmm.
more bananas a day I need to be
Yeah, you
eating,
know,
just in case, just
or
for
even just to know your baseline
yeah.
potassium level, because we all are different.
Yeah.
There are general normal ranges, but we just want to know that for myself, for my personal information I see online.
I have a question. If somebody wanted to get like a full workup, obviously this would come from their doctor of
Mm-hmm.
all of their baseline. Is that something that they can come to doctor's hospital for?
Sure, we based on what your doctor recommends
Mm-hmm.
for your testing, we have things very basic test is called the SMAC 25. That gives you a whole range of chemical testings that is done, and that would cover everything from your chlorine levels, potassium levels, sodium levels, your glucose, which is important for diabetic patients, and a slew range of other testings such as bilirubin and other testings. A lot of times you can request that on your own, but we do recommend you go through the doctor so he could truly identify what you would need. but that would be one of those baseline testings that everybody should generally have on an annual basis.
Okay. That's really good information because I think when people think labs, they only think once you admit it.
Hmm.
But I think it's so much more than, like you said, if you have an inkling of something,
Hmm.
and you feel like, you know what, I want more energy, come to labs, get your baseline, so you could either speak to your physician again,
Yeah.
and see how you can improve on your health.
And that's the thing too. We always think of doctor's hospital lab as a place that we go up solely when we need to go to a hospital.
Hmm.
But we have expanded to so many parts in the Bahamas, and we'll get to that later.
Hmm.
But we have expanded so many
We actually could
places.
get to those
We
now.
will get to that now. We can talk.
Where are those places?
Where are those places? We have so many places now opened up where you can get the same services done at Doctor's Hospital, Collins Avenue,
Hmm.
closer to home, closer to you, right to
Hmm.
your footsteps. We have opened up clinics in Carmichael,
Hmm.
which is a place where you can get both seen by a clinical physician and laboratory work done.
Okay.
We have Doctors Hospital West, where you can do that also, have that service. But also we have rural testing sites,
Okay.
such as Meldon.
Okay.
All right, we have Meldon, we have Carmichael, we have Doctors Hospital, CMC, as you call it, down there in Centerville.
Hmm.
But also we have expanded to the Out Islands because we feel that the Out Islanders need that Doctors Hospital
They
experience.
need the touch.
They need it.
Your
So,
trusted best care now.
hey, you know it. So places such as Exuma are
Mhm.
now experiencing that Hospital level of service.
Okay.
Places in Freeport, hey, we coming big in Freeport. So look out for us. We're doing a lot of big things in those areas in the Family Islands, and just look out for us.
Does PI can you get services, lab services? I guess the collection of it on PI as well, or no?
Collection services is done at um it can be done at PI
Hmm.
once requested.
Okay.
You request us to come out there, you want your labs done at Paradise Island, we'll do that. We come right to you um and right at your footsteps basically.
When we talk about what new tests or technologies are coming on stream within the lab space, like what is lab tech? Not the person, but
Mhm.
what is lab tech
Mhm.
looking like these days?
You know, it's funny because what I am as a professional is a medical technologist.
Right.
So basically, I deal with medicine, but the second half of that is
Technology
technology.
and equal as
And
well.
equal, those two things coincide.
Right.
We work with so many high tech machinery now that is coming that we bring in to do more testing in house. We now have PCR testings, which is polymerase chain testing, which
Hmm.
is a highly specific grade of testing. We really innovated that into the Bahamas itself. We did it a lot as during the pandemic, getting your COVID testings confirmed
Right.
faster and
Mm.
more precise than anybody else in the region. This gave us, like you said, the ability for patients to catch their flights and do other things necessary. But beyond that, we are bringing in brand new and the most state of the art instrumentation into the lab. Things that help us do molecular testing, that's down to the DNA aspect of testing. That is the highest level of testing somebody can find
The most
anywhere.
accurate, I'd imagine.
Most accurate, most
It's so
precise.
fundamental.
Hmm.
Right?
So these are things and devices we are bringing in to Doctors Hospital because our dream and our goal, what we are currently working on, is to be the reference lab not only for the Bahamas
Mhm.
but for the entire region.
Right. I know that AI has been a thing. It's a huge thing. Have we adopted AI or incorporated that into any of our lab work?
Yep. AI is instrumental in how we gather and utilize data. All
Hmm.
right. Especially in the blood bank aspect of it and blood donations, we utilize AI into seeing how we can best serve our patients by going out into the different areas, seeing which areas are more progressive or more useful in giving us donations
Right.
and just within our scheduling of blood drives and other things. AI is a powerful tool, and you don't want to get left behind
No.
in the dusk of utilizing it. It's like when the internet first came about. You had those internet doubters. They're like, "Oh no, it's the
Will they end
internet."
of us?
You know, AI is a tool. We use our precautions on the instances we use it because in the hospital we do have a lot of confidential
Yeah.
information that we hold dear and we don't want out.
So confidentiality is a really important thing, and I want to just to stress that again.
Don't sound too soft.
I want you to stress it again. The information that you use to better the work that we do within Doctors Hospital does not include patient files.
No, we
Good.
don't utilize
I just want you
AI.
to make sure
Yeah, we do not
we don't use AI to
in-
diagnose patients.
No, not in any terms of, like I said, we use it basically for scheduling
Right.
drives or pinpointing out different means or the best events we can go to, staffing, scheduling for the amount of patients we may, amount of employees we may need on a shift for a certain amount of people. All right. As it pertains to utilizing it for diagnosis, we strictly by the books.
Yeah.
And that's
We've
textbooks.
done our work.
All right. We've been to school for this. And we lean heavily on the knowledge of written textures, text and references when it comes to our policies and everyday interactions with patients.
Good, perfect. So in the 21st century, we've seen emergent diseases such as SARS, Ebola, Zika, and MRSA, all of those. What role does the lab play in not only kind of identifying these diseases, but also preventing the spread of them?
Well, like I said, two big things. Those are two big things you brought up: identification, prevention, and spreading. Um, as you know, things such as dengue, malaria, these are all things that people in the world come in contact with. All right. Um, as a laboratory, it is our duty to release information to the Ministry of Public Health when it comes to anybody who may have come in contact with dengue so that they are aware of patients who may need to be isolated from the general public, or they may be aware of which areas may need to be sprayed for mosquitoes and different things. And this is how they really track pandemics and endemics around the world, is through laboratory testings. As people come into the hospital, we look at their doctors would see them and off of their diagnosis and different things, they would send down for testings. We would confirm those testings. And then from there, send that information on to the Ministry of Health, and they would do set the things necessary to, promote good public health. So we play a vital role when it comes to general public health, just for the entirety of the Bahamas, but also personal public health. You knowing what you have, you knowing what you need to get better, and the information to inform the doctor of this.
So I wanted to talk about. So we talked about confidentiality earlier, but I also wanted to expand on that a little bit more because I wanted to. I think it's important for the public to know that once you come to be tested by us at Doctors Hospital, that information belongs exclusively to you.
That's very good point, and I am an advocate of that. Being in one of the most outwardly facing areas in the blood bank,
Right.
we go out into the community, and for donations to come in, for people to feel safe and secure about donating blood, they have to be assured in the notion that anything that we find, anything that we test for, is their business and their business only. All right. And I am a true advocate of the confidentiality that we have. It is our duty to it is our duty to secure your personal information that you willingly give to us. Any testings we may do in the blood bank is kept solely between us, the physician, and you. All right. So we want to ensure and reaffirm to the public that your information is kept within that circle, and that is it.
So let's talk about regulations. So what regulations should patients and the public be aware of regarding laboratory results you talked about donations,
Mm-hmm.
but just laboratory testing. I'm thinking about a scenario. Um, someone is someone's advocate. If you're the patient's advocate.
Mm-hmm.
I'm advocating on your behalf. Am I entitled to that information, or is it the patient? The patient has to be entitled to it. Is it
Um,
only the patient who's entitled to it?
if you are signed as that patient's, there are certain circumstances
Mm-hmm.
um, that would have somebody else be the sole
Recipient of that
recipient
information.
of that information.
Mm-hmm.
One of which is if we're dealing with minors.
Mm-hmm.
Of course, if we have people under the age of 18,
Mm-hmm.
your parent would have to be informed of anything that's
Mm-hmm.
happening to you or anything because they are your guardian.
Right.
But there are also instances, but the patient themselves would have to be completely um,
Basically incapacitated.
incapacitated, and you would have to actually be the lawful designee for making decisions on behalf of that patient.
So only the lawful designee can is able to
Would be able
would be
to
able to receive the information.
receive information or make decisions on your behalf if
Okay.
that person is unavailable, or if we're dealing with, of course, minors
Mhm.
who don't have the legal means to do the process.
Okay. So we are celebrating our sixth. Is it our sixth?
I know it's a
I think
lot.
we recently celebrated our sixth JCI accreditation.
Hey,
What does that mean for lab and the benefits to the public? So, just for clarity, when you see JCI on any of our doctors' hospital paraphernalia, it stands for Joint Commission International, and it's an international hospital standard. So, we're the first JCI accredited hospital within the region. And when JCI comes around, the hospital is in a buzz.
Mhm.
It's basically because we have a standard that we have to keep. And so when lab is a very serious part of the way that we operate and what we do here in the organization. So tell us, what does the JCI accreditation mean for the hospital and for lab?
That's a very good question, Eddie. Um, I'll try to break it down as best as I can
Sure.
because that JCI accreditation, a lot of potential patients should be aware of what that means for them.
Mm-hmm.
All right. In terms of laboratory, what that means is, and I just gonna
Go
put
straight
this
into
out
it.
there, the laboratory was signaled out specifically by being given a gold star by our most recent JCI accreditation. What does that mean? I've been here at Doctors Hospital for better half of 10 years.
Mhm.
And through all of our accreditations, this was one of the first time I've ever heard that.
Chest up.
I'm just saying, the only department, if I remember, wink, wink. But hey, what that means in in laboratory terms is
Mhm.
our standards are up to par or above, which I like to go. Any other hospital, not only in the region but worldwide. That
Mm.
accreditation body is JCI. That's Joint Commission International. All
Mm.
right. So what basically that means on a laboratory setting is that our standards of quality control, our standards of calibration for all these high tech instrumentations
Mhm.
we utilize the utmost care and critique when it comes to producing results for patients.
Mm.
So, at a laboratory standings, you can be assured that whatever results Doctors Hospital give to you could line us up with anybody else in the world, and ours would be number one.
We're the best to test.
I'm just saying, that's what the gold star
You heard it
is.
here first. The best to test.
Now, but also on why should patients
Why does that matter?
why does it matter to the patient?
Right.
All right. If you've ever utilized any type of machinery in your home, right? I'll say a glucose monitor. They utilize an internal quality control. That's basically letting you know that the instrumentation is working how it should, so that you have that assurance that the results it's giving you is correct. It is important that on a daily basis, a monthly basis, annual and biannually basis, that these steps in quality are done correctly, and you are assured which results you have are the utmost correct. Because believe it or not, an incorrect result from any laboratory can lead to disastrous outcomes to your health.
It can.
So, what this accreditation does, it assures the patients that Doctors Hospital remains atop keeping the standards of quality control when it comes to distributing their results, when it comes to handling your samples. So that's a lot of things. That's like mislabeled samples. That's daily QC, ensuring the machinery is working properly so that the results we give to doctors to make their diagnosis, to make their plan of better health execution is on key. So patients should really pay attention to this, especially when they go to random clinics around Nassau itself. Not to say that they aren't doing what they should be, but Doctors Hospital has that gold star on their door to give you the assurance that, hey, we have been auditing ourselves and we do it on an annual basis to ensure the service we provide and your results are top notch.
That kind of answers the other question I had about why is it important why is Doctors Hospital the best lab to utilize for your services? I think you basically explained it all.
I mean, but that's such a loaded question that has so much to do with it. Why are we the best? Well, that is one aspect of why are we the best. I must say, I must commend my employees and associates who work alongside me. They take the utmost care in collecting your samples, in processing your samples, and resulting your samples, getting those results back to you in a timely fashion. Why is it the best place to work or why is it the best laboratory? It's because, hey, when you hear Doctors Hospital, you walk around Nassau, you know that level of standard is top notch, is A1. You can put us up against the best companies in the world.
I love the brava. I love this. And just let me tell you something. If I was never convinced of lab services anywhere else, I am convinced.
Let me tell you.
I am absolutely convinced.
But we try the service we try to provide. And I know we'll get there soon, but one of the things is what are we doing to improve on our service?
And then you can go into the services actually.
Yeah, what we really want to do is emphasize a service that we want to bring directly to the people. We have a mobile phlebotomy service. And this service is really, really, we set this out for patients who may not have the time that it takes to come in to a certain place and go through that whole documentation with insurance, then waiting until you're seen, this, that, and the next. And also for patients who aren't mobile. So maybe Grammy or grandma. We have a mobile service that we are initiating that we bring Doctors Hospital services to your doorstep. This service is accessible. This is not a corporate thing. This is not for the highfalutin of our society.
Even though we still would like
We
for you to
still love them.
participate in these services.
But we want you to know this service is affordable, this service is accessible, and this service is bringing our services directly to your doorsteps and your fingerprints.
I think every community wants to be touched by Doctors Hospital. At least that is what we want
Mm-hmm.
in this organization, for us to touch every single community and be able to serve as much people as possible through the services and the care that the high level of care, the JCI level care that we provide.
Yeah, but let me expand on just what that service means.
Please.
On how it is. Basically, you just call the laboratory as long as you have your doctor's requisition or test information that you want to have performed. We schedule you and we set you up via our patient payment portal. So this can all be done at your leisure, online, when you want to do it. They call you back once everything is done in terms of insurance, because we know we can wait on lines for hours waiting on insurance callbacks. So they call you back, they email you, let you know insurance is clear. When would you like to schedule our phlebotomy team to come out? You send us a location of where you are, all right? As long as it's in a safe environment, safe and secure, we come out to your doorsteps. We send our team of professional phlebotomists out there who knows the test that needs to be done, who knows which tubes or which samples needs to be drawn off. They draw it off there. They do the necessary labeling or processing at your bedside or work site or job site. We go to all, and then we process everything back at the laboratory. Once those testings are completed, you can sign up for our patient portal and have your results sent to you in a digital format right to your fingertips. So we're at your doorstep and your results are right at your fingertips.
That's really convenient.
I think so.
Yeah.
And it's something we really want to push this year and into the future. So anybody interested in having this done, maybe for a grandma who is bedridden, or hospice patients who aren't really mobile, or just for me and you who don't have the time to go.
Who just don't want to go.
You know?
I don't want to leave my house today.
That's what it is.
But I need to get tested. What am I going to do? Call Doctor's Hospital.
That's all you got to do. It's accessible. It's affordable for everybody.
Good. Are there any other services within the lab space that you want to tell us about?
Yes, we have certain promotions that we have currently going on, including our this month is prostate month. So I think you can just come into any of the doctor's hospital sites and have a prostate screening done. Our key thing with this is all men over 40 should have or start testing for prostate cancers. So these are one of the big things we want to promote for this month. It's just a $30 fee. If you don't have a physician, we hook you up with one of our doctor's hospital physicians on site. So they can have the information necessary for you so you can know your next steps that you may need, whether or not your screening comes back positive or negative. All right, this prostate screening that we do here, it is a blood test, and we utilize a PSA test, which is one of your early indicators of prostate cancer. An elevated PSA can really set you on the way to know what your status is on the lines of prostate cancer and tests.
I love that.
While we're on that, we also want to emphasize our other hormonal and cancer identifying tests that we provide in-house. A lot of women, as we see now in our society and population, women have now been identifying issues with PCOS, or men with certain hormonal testosterone, low testosterone levels, or people with certain cancers, pancreatic cancers. A lot of these testings can be done at doctor's hospital in-house. We want to emphasize our hormonal testings, which is done in-house. That's your LH, leukocyting hormone, your testosterone, estradiol. All of these testings are done in-house. What does that mean for the patient? They get their testings back quickly. It doesn't have to spend thousands of dollars going across the pond, spending hundreds on airline tickets for travel, car, probably a hotel. You can do that right here at Doctor's Hospital, have your testings performed, and your laboratory testing sent to your doctor of choice.
So essentially, we provide a comprehensive list of tests that persons who are interested in finding out practically anything about themselves from a microbiological level. They can come to Doctor's Hospital and have it done.
Anything from molecular straight up to the big. We perform DNA testings. We perform hormone testings. We perform carcinogenic antigen testings. These are things that 20 years ago, Bahamians couldn't dream of having. We have that right here. It's homegrown, done by professionals.
So for persons who would like to access this lab service, who can they call?
All right. You can always call the laboratory and you can ask for either me, Brensil Rolle, or Miss Cutel Taylor. Our numbers would be 302-4759. And that would be the best way to schedule a mobile phlebotomy if you are interested in it. Or even if you have any laboratory queries, we are always there and open to talk about what you may need, what you can expect. If you want labs done. And of course, if you want to donate blood or set up a blood drive.
It is most important.
Which is most important. We ain't getting into that too much today, Eddie. But
No.
If you want to have a blood drive, again, you can call me or Miss Cutel and 302-4759. Contact us. Just call Doctor's Hospital and ask for the laboratory. Ask for Brensil or Cutel. We'll be more than happy to schedule your blood drive, your mobile phlebotomy, anything you may need laboratory.
That number is 302-4759. And thank you so much for being on the podcast. It's good to know about the different areas within the organization and within the hospital specifically, so that we know how we're providing services and all the services that we could provide. Thank you so much for being here.
Thank you, man, Eddie.
On behalf of the Doctor's Hospital podcast and my producer, Gally, thank you so much for being here and thank you for listening. If you need any lab services done here at Doctor's Hospital, please give us a call and tune in to the next episode of the Doctor's Hospital podcast, where we provide you with the best care now. So our Doctor's Hospital prostate cancer screening has been extended. You can pop into any one of our locations, go in, take the test, and it's only $30. Remember, it's not a finger, just a test.